Capacity limits are being reinstated on large indoor venues in Ontario. Starting Saturday, places like sports and concert venues that can hold at least 1,000 people will be limited to 50% capacity. Jamie Mauracher reports on the evolving rules and what you need to know as we head into the holidays.
Congratulations, you did it. You did it.
Awesome.
I'm so proud of you.
Just when vaccines made it feel like we were getting back to normal, Omicron appears certain to set us back.
We just canceled everything. We are getting together for Christmas. We're not having any Christmas Eve party.
In Ontario, Omicron is now COVID's dominant strain, and experts are clear. A double dose no longer means you're not at risk.
We have to give up the sense that if you're with other vaccinated people, it's okay, and go back to assessing our risk based on just the number of people you're seeing and how close you are to them and whether you're protected when you're close to them.
In the setting you're meeting those people in.
Is it indoor or is it outdoor? If it's indoor, how ventilated it is, how many people there are there, how long you're going to be there, what sort of activities you're going to do.
Questions that are all too familiar as assessing our individual and collective risks becomes our norm again.
Our recommendation is don't have mass gatherings.
That means avoiding large sporting events, concerts, even big holiday parties. Dr. Alison McGeer also suggests boosters for everyone over 18.
The way out of Delta was getting your second dose, if you remember. The way out of Omicron is getting your third.
Failing to do anything means more Canadians without question will get sick. And while overwhelmed ICUs aren't a guarantee nationwide, experts say Omicron's aggressive transmissibility means entire hospital departments could have to isolate. Imagine the fallout in a critical care ward, at a school, or in businesses. Even one new person in your personal bubble opens the door to COVID. Some holiday travelers have decided it's worth it.
We were taking a risk. We were hoping it's not going to lock down.
These are personal choices every Canadian will have to make, but their impacts could be felt by everyone. Jamie Mauracher, Global News, Toronto.
In the UK, cases of Omicron are now doubling every 2 or 3 days, and it's now reporting the highest number of infections since the pandemic began. Britain recorded more than 78,000 new daily infections today. That is 10,000 more than its previous record set in January, when the UK was in lockdown. In London, 60% of infections are the Omicron variant, and the head of the UK Health Security Agency calls it the most significant threat since COVID began. While hospitalizations aren't rising quickly yet, the sheer number of infections could change that and overwhelm the healthcare system. Crystal Goomansingh reports.
The wave of Omicron continues to roll in across the whole of our United Kingdom.
The warnings have turned into reality as reported COVID-19 infections hit a new high.
I'm afraid this is going to be a problem.
England's chief medical officer says the new variant must be taken seriously. Infections are now doubling in fewer than 2 days.
The growth is Omicron. What we've got is two epidemics on top of one another, an existing Delta epidemic, roughly flat, and a growing Omicron, very rapidly growing Omicron epidemic on top of it.
Those two epidemic streams causing ongoing infections are also a concern in Denmark. It's just behind the UK in identifying more than 4,500 cases of the Omicron strain. With infections rising, attention turns once again to the ability of healthcare systems to cope. France is struggling with Delta. Add in Omicron, and officials warn 4,000 people could be in ICUs by Christmas. This variant does not put into question our strategy to fight the virus. On the contrary, it reinforces it. It makes our prevention tools, vaccinations in particular, more necessary and urgent than ever.
Omicron is spreading so rapidly.
Epidemiologists say that while there's a lot of ongoing research, what is known already is troubling.
There is evidence that is less severe, but the number of cases we have are so many that loss of severity would have to be substantial in order for us not to have real problems.
Exhausted healthcare workers are not only being called on to care for those falling ill, but also to vaccinate others as a means of protection. Boosters, especially in the UK, are the main line of defense. Crystal Goomansingh, Global News, London.